Awesome. Welcome, you guys. Melissa, always great to see you.
Same for
We're here
you.
today with a topic that we promise is not depressing today. No, but still might be something
Right?
that you might be dealing with because a lot of people are. So we want to talk today about Epstein Barr virus. You may more popularly know it as mono. Um, it's interesting. I'm going to share some stuff from a person I follow on Instagram. His name is the Medical Medium. He put some cool info out. Might not be for everybody, but he put up a post today about EBV. And I said to Melissa, let's talk about this. And the reason why I wanted to bring it up, you guys, is it's something I have been working on probably 3 years ago now, maybe even a little longer. I was working with another holistic practitioner, and they, during the course of my blood work, said, you have Epstein Barr. And I was like, and I didn't know what that meant. And she explained it's mono. I was like, well, I had mono when I was 20. And she was like, yeah, that's nice. But once you have it, it can just lay dormant and then really cause a lot of issues. And so it's interesting. One of the girls who's on my team, her mom, I remember when we were launching her business, her mom was like, I'm being treated for Epstein Barr. And it's so much more common than we think. And again, traditional practitioners may or may not necessarily recognize this, but if you're working with holistic functional practitioners, then they will absolutely understand what we're talking about today. And it could be like, I love what you said, Melissa, that it could be a part of an underlying chronic condition, you know? Like if you're like, man, I'm doing all the right things and I'm just tired all the time. Or I just said to Melissa, like anytime I get any sort of little virus, the amount of sleep that I need to get seems to me a little crazy. Um, but it's like maybe it's not fully, out of my system either. So, and it's a process to get rid of it. And it sounds like not every practitioner really understands the length to which you've got to do it. Or, and I will say this too from personal experience, even though I think it's a different formula, the antiviral that I was drinking tasted terrible. So people struggle taking it. And I get that because
Yeah.
I like even the binder you have me on right now, my husband calls it motor oil because that's what it looks like. And every night I'm like,
Yep.
here we go.
Here we go.
But I am the person that if it's going to get me to the desired outcome, I can tough out a lot of things. But I could understand why many people would be like, I am not drinking that. Like, there's probably been one day, I think one day when I wasn't feeling good, I'm like, I don't know if I can drink this tonight. And I took my other binder. And the next day, I'm like,
Yeah.
all right, buck up and put your big girl pants on. You're fine. But it was one night, I'm like, I can't do it today. I might throw it up. But
It's tough.
so we're gonna dig into this, you guys. And Melissa, I don't know, like if you want me to put the slides up right at the gate or if you want to kind of
great.
All right.
Yeah.
All right, cool. So I'm going to share this with you guys just because, like I said, I think it's some good information. And as with anything, like if you're working with someone, then just be sure to talk to them about kind of this. But, this goes into the stages of infection. And Melissa, I'm sure you can probably better articulate this and what the heck this little graph is here.
Yeah, this is a really good one. I have never seen it laid out like this, but I really like it. So just kind of to give you a scope of how many people have EBV. I mean, most of the population in the world actually have this living in their body. And as far as we know right now, what really, like this is a virus that can lay dormant in the body and can flare or be a low level trigger for, say, chronic illnesses. So when your body's doing good, right, you're in a really good space and you get virus and this virus of EBV, mono, whatever, it may feel like a cold. You may barely get sick. You may have contracted it when you were, a little bitty kid. And, just another runny nose and a cough, and your mom was just like, yeah, whatever, they'll get over it. And you do, right? But it stays in the body. It lies dormant in the body. So from here, depending on your overall wellness and how your body is able to retain and, keep a level of wellness for you, that virus may never become something that is contributing to illness in your body. However, as other things come in and our body experiences other hardships, if you want to say, other things happen, we get sick with other things, we may get, start developing chronic type illnesses. That's when we start looking for, okay, do we have EBV and what part does it play in what is happening in the body? Does that make sense?
Yeah. I mean, I think the part that blows my mind, even looking at this, though, is like the nesting into the organs. I'm like, dear Lord, right? Like, and I know we had talked, well, so Melissa and I worked together. If you haven't watched us before, she's helping me with some things, and we actually connected organically. And then I said, hey, could you help me, because I'm always like, what's the next way I can improve my health?
Mm-hmm.
But one of the things I had shared with her is that, I would get winded easily, and we're working on right now, is that a parasite issue? But it's also, I'm like, all right, maybe that is part of this, and I know a good friend of mine, her son has celiac also, and she was saying, he also has a lot of inflammation around his lungs. I'm like, man, maybe he's got Epstein Barr kind of hanging out there. And I'm like, she would not be offended if I messaged her and was like, hey, if you guys tested for this, but I think, I know I was under the assumption, like, you get mono, you move along, and then that you're good. But the fact that so many of us have it, because I mean, think about it, it's very easy to share. Like, like I know, like my best friend and I share drinks and stuff all the time. We never think twice about that, right? And and she is a phenomenally healthy human, and honestly, like, never gets sick. I think she's been sick once in the 10 years I've known her. But like, who the heck knows what I'm trying to share with her? Like, and obviously not on purpose, but unknowingly, or, if you have kids and they're taking snacks and things out of your hands or drinks, so I think it's important to just kind of understand this, and then also how it can kind of, I mean, the fact that it replicates and fortifies itself, like, man, like that's a little scary to me too. Like, oh boy, like this sucker can really kind of get that big and out of control. And then inflaming your central nervous system, right? Like,
yeah, that's when we see the chronic stuff. Well, stage 3 and stage 4. I've never really seen it broken out in stages. This is really like cool.
He's got some cool stuff. I don't know if it's going to let me. Oh, it is. Okay. So he breaks it down a little more into kind of these things. And I don't know if you follow him at all, Melissa, but he talks a lot about diet and things. But but this struck me here that, like, the fortifying itself, that it could take weeks, months, or even a decade longer, of like, it just kind of like laying dormant. Absolutely wild to me. I mean, that's the part where I was like, whoa, right?
Right.
And so for you, Melissa, what are some things that you look for if someone comes to you and says, hey, I've got these things happening? I know you are a fan of doing blood work to get a real sense of what's happening.
Yeah. I don't necessarily go to blood work for testing for EB.
Okay.
And this is why. So when someone comes to me, especially if they have like neurological type symptoms, if they've got anything that's affecting the nervous system, or if we have like a chronic fatigue piece, or if we have even back into like anxiety, looking at what is happening in the digestive tract, if there's a chronic issue there that we kind of have some mystery around, we haven't really like pinpointed, zeroed in, okay, it's this, right?
Yep.
We start to do the bigger picture. And I'm going to show you, let's see, let me see if I could share my screen with you. Share screen. I'm going to show you a, can you see that?
Hold on. I think I have to stop sharing then.
Oh,
There we
okay.
go. Okay, there we go.
All right.
All right. Oh boy, there's all these
Yeah.
yeast again. There you go.
Right. So this is a GI map. This is a stool analysis. This is one of the, like when we're starting to really dig in with somebody who has an autoimmune condition or something that's multifaceted, if we can't learn what we need from just basic blood work and we need to go a little bit deeper, this may be one of the ones that I choose. So this is looking deeply at what's happening in the body. And this is, I can leave links for this. This is just a sample report, but this looks at all, a wide variety of what could be happening. Like this test patient has H. pylori, and that in itself is a big deal. But let me go down here. I'm not trying not to get sidetracked here.
I know, because then I'm like, ooh, tell me about that. No, we're staying on track.
We're working on this. We need to see if Epstein Barr is present. And we'll be able to see in the result, like the numbers, to be able to get a better idea of, is it active?
Okay.
So this is a pretty reliable way to test for this. And I love that it's in context with so many other things. This is another big piece of this when we're evaluating what part could EBV potentially be playing in how this person's body is feeling, what we're seeing as symptoms, what is happening, what could potentially be, could be its contribution to what is off balance in the body. If you want to learn more about that, I would go here, Diagnostic Solutions Laboratory. That is, they've got so much information on this website. You can learn a ton, but that's one of the ways that I would be looking at EBV. So because it's a virus, it is a bugger to get rid of in the body. Yeah. So a lot of the protocols that even I was taught when I first started this work were way too short. And I started to say, okay, is there a possibility that we could actually get rid of mono or EBV in a person? And what I learned, and I'm going to show you, this is my favorite website to go to for really, this is my favorite herb for that. And I'm going to show you, please feel free to go here. Learn more about monolaurin. It is a very good broad spectrum antiviral. This is what I like the most, right? Is really understanding how do we use this, right? There's so much information on this website. Please visit it. But right here, monolaurin buildup, what are we using it for? Because it's a broad spectrum herb, it can be used for quite a few different things. If we have just something simple, viral, we can use it. We can use this. We can use this dosing chart. Please be aware though, when you do start using monolaurin, you've got to dose up slowly and make sure that you're using the right amount for your body weight. And I want you to make sure that you read this, what's on the other side of this link. What is herxheimer? What does it mean? What does it feel like? And what can you do about it? So often when our body is really being affected by EBV and we start really working on it, our body will have die-off symptoms. And for some people, it feels just like being extra tired. But for other people, it can be kind of severe, especially if they've dosed up too quickly. So even when we're using herbals, even though we think of them as plants, they're mild, they're easy on the body, we still have to be very sensitive to how the body is responding to that herb. Does that make sense?
Yep.
Okay.
Oh, for sure. I mean, and I can absolutely say that from doing years of herbal work, and it's amazing to be like, wow, how is this aggressive? But it's because it's working, right? I think the easy thing is to assume, like you said, like, oh, it's so gentle. And then you're like, no, but it's doing its job. And I know, like we talked about with parasite stuff, it's like as they're dying and releasing toxins, you know, it causes a reaction, right? And so it's just good to be aware of, like, hey, this could happen. And then, you know, that's why having a practitioner like yourself to check in with is helpful, you guys, because if you have someone you can reach out to and say, okay, like, what do we do? I know Melissa's had me dial back a couple times on certain things just so that I don't get too sick, because, you know, you do have to work with your body, not against it.
Exactly.
I'm the kind of person that can be like a battle axe and be like, let's just get through this, but you don't want to make it worse. So it's good to have someone to temper me in regards to that stuff, for sure. I'm like, it's fine, let's just go through it. I feel like I'm gonna die. Like
right. So you could see here that we can use this for bacterial, yeast, and viral. I've used this herb for most of these, but it is the most effective for herpes, in my opinion anyways, herpes and Epstein Barr. There are other things that are more effective for yeast and for bacterial, although we have to understand that when we're using this herb, if this is what you would choose to do, that it may be affecting these other things if they're in your body. So that can be also a part of the Herxheimer reaction that you might get.
Yeah. I would imagine, you know, if someone's got like a yeast issue and isn't necessarily aware, and then start treating the Epstein Barr, not a bad thing that it's going to take care of all these things, right? But,
or at least affect them.
Yeah.
So sometimes it's a good idea to really look at the big picture and see what piece EBV plays. And quite often there are other things that need to be addressed first before you get to EBV. So when you are, that's one of the reasons why I like to suggest working with a practitioner, because they can help you get all the layers and get your body ready to actually address that. Because if you address it right off, it's going to be much harder on your body than if you've prepared and your body's ready. Does that make sense?
Totally. And I think that is important for folks to know, because I get it, you guys, like, I am, as Melissa will tell you, like the person, like, let's just get rid of this, get it out. But you do have to work in stages, because, and I will say this, like, and I appreciate that, because, you know, in working with some other people in the past, didn't work in these levels. And you know, I'd sometimes be on like literally 15 different things. And like, I'm like, how is this all working together, you know? And so, and it's overwhelming even for someone like myself. So I think working in pieces around, all right, what's the first thing we need to address? Then what's the next thing? Because I could see how badly that could go if we were just like, let's kill parasites and do this. I can't even imagine. I think I'd be like in a coma for like 3 weeks. Because again, like, if things are working, right, like, and we want them to work, you know, you do have to pay attention to like, what can I actually handle and how is this going to work, right? So yeah, I mean, I think it's I think that's important for people to know, and it is the real reason why you need a professional guiding you, because you'll make yourself sicker is really the thing, right? And like we've talked about, even, you know, with, and I know I keep bringing up parasites, but we had just done an episode about that, you guys, a couple weeks ago. And so it's a similar process with any of these things. If you don't fully completely do the treatment and they're not fully gone, then you make a bigger problem than perhaps you started with, right? So that's another piece why it's important to have someone guiding you, so that way you really know, like, okay, is this stage of our treatment done and we're moving on to the next thing, or is it going to take longer to get rid of this than we thought? And that, I'm sure, happens sometimes, right? So but I think one of the things I appreciate so much about your work, Melissa, is you're so thorough. But it's because you want people to feel better.
Exactly. But I also, in the process, is that I really want you to learn and anybody that I work with to learn what is happening in their body and why.
Yeah.
Because I'll tell you what, we get to this place of wellness, right? Our body is just perking along, but life happens. Things are going to happen. But if you understand what's happening here and where some of your weaknesses are, if I can say it that way, and you have tools then to use when that happens, because the end result is continued wellness, even throughout life, even when things go sideways, right? Is to know how to deal with those.
Yep. And, I mean, the pieces too, and one of the things I've learned from you that has been so helpful is to not have shame around it, right? Because a lot of us have these things, you guys, and it doesn't mean that you did something terribly wrong, you're bad. I 100%, especially around the parasite thing, was like, ugh. And so like, what did I do wrong? How did I get these? But it's like, it's never one thing, right? That's certainly something I have learned from you and from my own, just nutrition journey and everything else. Never just one thing that like really it all stems from. And I do think that actually is a real error in our like Western medicine, is that, they try to take one medication and treat around the things, and it doesn't really, and it also doesn't actually hit the root cause, right? So, if you can think of it this way, doing a little more of this legwork and doing something more comprehensive is going to save you time down the road, but also potentially years of side effects or other strange things. And again, I'm a person who wants to feel as best as I possibly can. So to me, do these journeys feel longer? I don't know. I'm also a person who had very bad experience with traditional medicine. So I would say no, because I'm already feeling better than I have in a really long time. So I see the absolute benefits of working holistically, and how it works with your body to reach an optimal state. So, I'll never be one for the quick fix, but I think it's important for folks to understand that, because when you are dealing with, especially an invasive virus like this, that you may not even know you have, you might be like, well, I feel fine. But then as you're listening to what Melissa said about some of these kind of chronic things going on, I mean, I feel like every person I talk to is like, I'm tired. And I'll be the first to say that I usually don't ever feel tired. But when I get sick, man, I'm like, I gotta lay down. Now, I also am a person who runs full throttle, which Melissa knows. So like, I am also like, well, maybe it's when I get sick, my body's like, okay, we're really taking this chance to break. Who knows? Again, I'm sure we'll get to that stage in my health journey with you around if we need to do that. But I think it's important to highlight, because I really am learning so much about a lot of people have a lot of these underlying things, don't realize they're going on, aren't even sure how they would address it. And so, we're always huge proponents of, think about maybe this is something you've got going on, so then it can be sorted out, so then you can finally feel better, right? Because, if someone's going to a neurologist, I will share this story. So one of my clients who I adore, she's the most beautiful little girl, and she chronic headaches, stomach stuff, all sorts of things. And they did a food allergy test, and it came back that she absolutely should not be having dairy or gluten. She's a really high gluten sensitivity, very likely celiac. And then, but I get it. It can feel hard to make dietary changes. So, they were a little resistant. And especially as a teenager, I know that you don't want to kind of be different. So the thing though that kind of put her over the edge was then she started having really bad digestive issues. And that was when she just was so uncomfortable that she finally said, all right, I'm ready to try.
Yeah.
So, I put together a meal plan for her to help her and at least get her started. Yep. And, and I said, you just got to stick to it. And if you're feeling like you don't know if you can text me, if you're out with friends, send me the menu picture. Like, because this is the thing is, for someone like her who's in so much pain and having such low quality of life at such a young age, which I really understand. I know I shared with you that I got to the point at like 20 where I was like, this is not how we are supposed to feel. And it really made me hopeless for the rest of my life. Like I was really like, what is the point of all this, And so
Right.
when you feel that badly, you guys, that's when you got to go, all right, like, am I really ready to make some changes here so that I can feel better? Because our normal state is health. And I know you and I have said that before, Melissa, and I think so many people are used to not feeling well that they think that's the normal state, but it does not have to be the case, right? And so, if you're watching this, no matter how old you are or how young, if there's stuff like that going on, like it I would hope it would be worth it to investigate and try to just figure out what's happening here, right? But
Yeah.
I get it can be a jolting change, but I think once you hit that point where you are just over that threshold, it's like something's got to give, right?
Yeah. Yeah.
Yeah. Yeah.
And I like that you touched on the thought processes, because that is a huge, huge deal, especially when we're just kind of in the investigative process, really trying, working on digging through and figuring out what is at the bottom of stuff.
Yeah.
That it can get a little frustrating. It can get a little long because you're like, oh, we figured it out. And then we address those things and there's still some stuff left. And then you're like, well, we missed something. And I want to really kind of reiterate what you were saying around the guilt thing of, gosh, what did I do? Or, all these pieces that can come in. But having patience and understanding that we can see the top layer, we can address that. And then there's layer number 2. And then there's layer number 3. We just keep going and listening to your body and really working towards getting you to well. And whatever that means for you. But the mind piece that you touched on is so important, to not let yourself go to the place of, what is the point? And I remember being there when I was diagnosed. I mean, that's horrible. I literally gave up on my future. And we don't have to do that.
Right. Yeah, I think it's hugely important. And so, and I know we usually frame it this way, like we do these, you guys, to give you hope, to know so that there are options, there are things that can be done.
Yeah.
And whether you work with one of us or you have someone that you're working with, and maybe this brings you an idea to bring to them, whatever, like I think one of the greatest things you and I do, Melissa, is like kind of just go through things. Like if I'm like, hey, is there a possibility this is happening? And and she's so great with that. And for me, it's reassuring, like to have someone that I can say that to and be like, I don't know everything about this process. And, this is your wheelhouse, just like, we have conversations about mental health stuff and you're like, hey, tell me more about this, And so I think it's just really important, you guys, to make sure you have mentors around you. And mentors do include practitioners, because they're people that are just further along in a journey or have mastered a skill set and know more about these things so that they can help you. And it's hugely important when you're going through stuff like this, because I know we said it about the parasite thing. Excuse me, if you hop online and you look it up, oh, sure, people will sell you things, right? But you don't have any support when you're going through symptoms, nor do you really know if that's the best formula? As I've learned so much about that process, even I'm like, man, I don't know that these other things out there, do this and do that and whatever. And you actually will also save yourself the headache of buying 17 different supplements, which I know I got to the point before Melissa and I met. And I was trying to deal with one thing, and it's kind of like you're saying, it was like kick back something, but then it would rise up again because it wasn't really eradicating. And these were expensive supplements, you guys, and they weren't garbage, but they were, of course, not working because it wasn't dealing with the root issue. So, and I want to just say that because, it's always important to make sure that you are working with someone who can guide you and help you figure it out, and who this is their area of expertise. Because again, if you're already taking the time to do some digging around what is going on, get get someone to help you with that process. So
Yeah, completely.
but if,
Completely.
any of what we said today resonates, like, reach out to Melissa and, see about getting some of this testing done to see, like, all right, do I have Epstein Barr? Is that what's been going on? And I know for me, when we discover these things, it's a relief so that we can fix it. I think that's the piece that always comforts me, that we can fix it. You don't have to feel like all hope is lost, right?
Exactly.
And so it's just like, all right, we're going to deal with this. We're going to fix it. We're going to move forward. And like I said, I just keep saying to even all my friends, like, I cannot wait to see how I feel in 3 months, because I'm feeling so much better already. And I know my body's getting stronger. And I'm like, man, like, that's so cool, to keep thinking, like, what's this next level going to feel like? And so I just encourage you guys, because what I'll say, and food sensitivities have gotten a lot less, and there's certain things I'm not going to eat because I don't want to. I'm never going to try to eat gluten. That's not a goal for me, but for me to not react if it's around me is a big thing. My sensitivities have gotten so bad. So I just kind of want to give a little, I guess, global picture too, of kind of like, why would you do this? Because, if you've got stuff going on, you guys, it may seem not interconnected, but it really could be. So, and again, Melissa's a great resource and can really help, and her team can help. And I love what you said weeks ago. Like, I want you to feel better. I don't want you to be like a client forever, because I want you to heal. And the coolest thing about that is, like, because then people are going to refer you. I mean, I've sent Melissa's number to, I can't even count how many people at this point. I'm like, just talk to her, like, and see, because I'm always amazed at your wealth of knowledge, my friend. And I know your passion is helping people to feel better, because if you don't have your health, you have nothing. Right? I mean, think about it, you guys, even if you're a multi-billionaire and you feel like crap every day, there's only so much joy that money's going to give you, right? And so, and I'm all for abundance and happiness, so please let me preface that. But, if you're healthy, you're going to be able to do a lot more with that, right? And also use it to help other people. So, I just think it's important. It's the most important thing. So, so you guys can certainly reach out to Melissa, and if you feel like maybe you've got some Epstein Barr, and that way you can start getting it treated for real, and get rid of it, because who knows, it might be lurking about, and then
right.
It's amazing to me how some of these things are so invasive. I think that's the thing that really keeps blowing my mind as we work together. I'm like, wow. Like, it's crazy to me. Like, it really blows my mind. I'm like, wow, okay.
Yeah.
Thinking virus that, you think like, all right, I had it, but it's wild. Like, I just keep saying that, like, this is wild.
Keeps giving.
Yeah, right.
And you don't really want it to.
In a great way. Well, it's fascinating how strong some of these viruses really are. I think that's the piece where I'm like, whoa, like, that to me is like, just, again, really fascinating. And for sure, I just think, but who would want to keep living with that, if you can get rid of it? Because it will, I mean, here's the thing too, you guys might be like, all right, well, I feel okay. But if you really step back and think about it, and unfortunately with something like that, it seems like it's probably going to rear its head at some point in some way. And I think the biggest kind of lie we're sold, certainly in our society, is like, when women hit a certain age, they're just going to feel tired and gain weight and whatever, right? Like,
it doesn't have to be that way.
It doesn't have to be that way, you guys. And this is something, like, I know from people that I'm connected with that are in phenomenal health in their 50s and 60s and feel great. And, you don't have to go that route. There can absolutely be a different way. So, but you do have to deal with some of this underlying stuff to be able to get there. So,
yeah, very true.
Well, great conversation again, my friend. And as always, I appreciate your knowledge and insight about these things, because it is always fascinating to me when we really start digging into this stuff. Like, And don't go just kind of order that stuff, you guys. Make sure you're working with Melissa or someone else to help guide you through the process, because die-off symptoms are no joke. I'm a tough cookie, and I'll tell you that those will take me out pretty fast. And I'm like, it'll be fine. And I'm like, this is not fine. So,
right.
But keep my eye on the prize, and I keep going there. So,
yeah, awesome. Yeah, I appreciate this conversation. Thanks for bringing it up.
Of course, yeah. I just think it's so common that I'm like, we got to talk about it. So, and as always, you guys, I know we say it every week. If there's something you guys want us to dig into, please share that with us, and we'll be happy to dig up what we know about it and have a conversation, because Melissa and I could talk for hours about everything.
Yeah,
it's just the core of what we want to do is help people. So, just love to kind of just keep bouncing back ideas. So, well, thank you, Melissa. I appreciate it, and I hope you guys learned something. That's always the piece too, right?
Right. Have an amazing rest of your week.
You too.